Hello, I'm Howie Sheriff, and welcome to You Call This Yoga's Backyard Blog in Cary, North Carolina. We're dealing with babbling brooks and flying airplanes to bring you Dr. Kiran Grewal, a functional medicine physician who's going to share some insights about breast cancer and how she approaches this chronic and invasive disease. Hello, Dr. Grewal.
Hi, thank you so much for having me, Howie.
Absolutely. Tell us about yourself and your philosophy.
So, I am a trained primary care physician, and I was working as a primary care physician, but I was really unhappy as a PCP. I was basically on the sidelines and waiting for a disease to happen instead of being in the forefront and doing the prevention, and that's when I got into functional medicine and it really changed my practice.
And so with functional medicine, tell me some of the pathways or protocols that you would use to address a patient.
So it's a super unique way of sort of organizing a patient in different systems instead of just treating their signs or symptoms. So we look at a patient with different systems. So we have 7 core systems that we're assessing each and every individual on. And based on their questions and answers, you may have one of the imbalances that I may not have, so we're really going deeper into the core systems, and it's a systems-based medicine, not a symptom-based approach.
Got it. To some degree. So how does that apply to breast cancer?
Yeah, so breast cancer is really interesting because it's a chronic disease. You may not know it. Breast cancer does not just happen overnight to anyone, Some studies have shown that breast cancer may be going on for 20, 40 years before we're able to pick it up with, conventional mammograms or other techniques. So it is a chronic disease, and unlike any other chronic disease, I have the very same approach. It's going to the root of the problem. And for breast cancer, with taking a functional approach, they're really, you're looking at the hormone metabolism. You're looking at not only the estrogen production, but also the excretion of estrogen from the body. So, and there's a big link between estrogen, inflammation, and insulin resistance. So we're constantly targeting systems as a full body approach.
So it shows that cancer by itself is not an individual entity, but an evolution over time of a disease state. And that's where Dr. Grewal has the finesse to help with that. Other tips that may be offered in someone just trying to learn more about how to reach you or how to address some of their existing conditions?
Yeah, we're in Cary, North Carolina. We're happy to see you. We offer telemedicine, but you have to be a North Carolina resident to use telemedicine. But as far as some tips and some cues that I can give you is, like I said, breast cancer is a chronic disease, so your lifestyle is a big component when it comes to prevention. So there are some studies that show that just by preventing, you might actually be treating some of the precancerous cells, and they may go dormant. So I highly recommend adding cruciferous vegetables, such as broccoli or broccoli sprouts that have high amounts of sulforaphane. Flax seeds are another one. Red wine has some evidence that it actually prevents, not the white wine, just the red wine. Certain organic soy products also, and that could be controversial. Some people look at soy as, pro-estrogen, but it's the plant-based. It does have a very good amount of phytoestrogens that are actually good for the breast tissue. And they have done some studies where they've actually given patients broccoli sprout juice before they underwent breast reduction surgery. And they actually saw a significant concentration of sulforaphane in the breast tissue. So it means by eating your broccoli or sulforaphane or Brussels sprouts, all these cruciferous vegetables, it is going to get to the source because the breast tissue.
Cruciferous, that is today's special word.
Yes.
Also, there's other modalities that Dr. Grewal supports, which is that she's a sponsor of You Call This Yoga, and her clinic and medical facility hosts what we call Yoga Day at Grewal Center, where she also provides free yoga for chair-based students, meditation led by someone who's very experienced with dealing with cancer modalities, and then we also have a separate yoga for those touched by cancer class. So Yoga Day at Grewal Center. Check out our website, yoga.org, or greywallcenter.com, and you can learn more. Is there also an Instagram account we should know?
Yes, we have Grewal Center MD. That's our handle on Instagram.
Wonderful. Thank you, Dr. Grewal.
Thank you so much, Howie.